An innovative treatment for back pain is now available in the upstate. The Foothills Regional Pain Center offers a technique called laser disc decompression. In other words, a treatment that's an alternative to surgery for herniated or progressively bad discs. Joining me in the studio to talk about this news is Dr. Marion McMillan. Thank you for being here today.
Thank you, Judy, for inviting me.
This is really exciting because there's so many people with back pain in our community. I mean, loads of people suffering from back pain, and in the past the only, I guess, alternative for them was surgery. Can you tell me about this procedure?
That's correct. As you note, back pain will affect at least 80% of Americans at some point in their life and become medically significant. The good news is that while 95% of back pain will resolve without serious treatment, a good number of patients do require more advanced treatment up to and including surgery. Herniated disc itself affects approximately 2% of the population, but it's 25 times more common in patients that have a family member that have a herniated disc. So we're talking about a significant public health problem that affects a number of people and costs society literally millions of dollars per year.
What do you do with laser disc decompression? Because it's supposed to be a, well, from what I read, a minimally invasive type of surgery.
Laser decompression is one of the methods of shrinking a herniated disc or reducing the pressure inside a herniated disc without having to cut the patient open surgically. The laser works much the same as shrink wrap responds to a hair dryer. If you get a gift basket wrapped and they use shrink wrap on the gift wrapping, it kind of collapses it or makes it tighten down around the basket. Well, in the case of the laser, the disc itself has a plastic quality to it. It has an elastic quality to it. And when laser energy is applied to the disc literally shrinks and the pressure inside the disc falls. And if the disc is pinching a nerve because it's bulging less or not at all at the end of the laser treatment. And the pressure inside is reduced to anywhere from 50 to 100% of what the pressure was initially, which we have learned is associated with pain in patients that have painful discs.
And so many people that I know that have the back pain that resulted in back surgery are back to where they started. It hasn't worked. Now, is this a successful treatment, or is there some numbers that you can share with us as far as that goes?
The preliminary results with the laser have been published by a number of authors, both locally, yours truly, as well as others nationwide. And we found that the beneficial effects of the laser last for at least 3 to 5 years following the completion of the procedure. The biggest reason for the recurrence rate of regular back surgery as well as laser spinal surgery, or laser decompression, if you will, is simply the progression of degenerative disc disease, which continues throughout a person's life. So this is how surgery, which is initially successful in, say, 60% of patients at 1 year, by 4 years out is no longer successful, or is there's no difference in the pain relief 4 years out than there is in patients that never got the surgery. And this is how people go on to get 2 and 3 or more back operations, because they're looking again for the initial relief. Well, with the laser, both because of the mechanism of action, where it's internally active, it works on the inside of the disc, as the animation shows, rather than on the outside of the disc, as back surgery works. The laser has a tightening effect on the disc, and we think, although has not been proven, but we think it prevents recurrence in the future, and this is why the duration of benefit's a little bit longer. Again, compared to spinal surgery, multiple discs can be treated just as easily as one disc with minimal additional risk to the patient, and the cost is significantly less than back surgery because of its non-invasive nature.
How about recovery time?
Sure, excellent question. Recovery time with the laser is measured in days. For office workers with relatively sedentary jobs that aren't physically demanding, we let them go back to work within 5 to 7 working days. Whereas people in more physically demanding occupations, such as construction workers, typically 10 days to 2 weeks, and so forth and so on.
Now, who is a candidate for laser disc decompression? Because we might have viewers that are watching this saying, you know, something that this might be something they want to try.
I'd like to say initially that there are many causes of back pain, and the primary purpose of the interventional pain specialist, such as myself, is to correctly, quickly, and precisely identify what the cause of the patient's back pain is, because as we said earlier, the laser is only effective for painful discs. Most patients with back pain do not have painful discs, but they too can be treated by the interventional specialist in ways that are appropriate for what they have and will eliminate the need for ongoing medications or ongoing treatments. But with regard to the laser would be useful for a person that either has a confirmed herniated disc, and it is known that the herniated disc is contributing to either sciatica leg pain or severe low back pain. If the patient has a bulging disc, or they're not sure whether the disc changes that may be seen on an MRI are significant, there is a test known as a discogram. And discogram testing will identify precisely the type of patient that is most likely to benefit from the procedure. So either a herniated disc by MRI scan, which is known to correlate with the patient's symptoms, or a degenerated disc, which has further been tested by a discogram, which indicates that the disc is painful and has the type of abnormalities that would benefit from laser therapy.
Is this laser therapy a new therapy that's available? I mean, I noticed that you've been offering it since 2003.
That's correct. It's not new, but like most medical treatments, dissemination takes time. The laser was initially developed and introduced into clinical practice in 1987 by Dr. Daniel Choi at Columbia University in New York City. He partnered with an Austrian neurosurgeon, and they did the critical experiments that proved that the laser was safe and effective. Well, you can imagine from humble beginnings such as this, anytime a new treatment comes to the forefront, we're already doing something about the problem before the new treatment comes along. And so new things require time and effort and a willingness by the existing providers to accept the new form of therapy. I believe that the laser holds great promise for the treatment of what most people consider to be a serious problem with complicated answers that don't always work out as expected. But like most newer treatments, it will have to establish its place in the treatment options available for patients that have this problem. And ultimately, it will be the interplay of primary care physicians, specialists such as myself, surgeons will become more aware of the treatment, and these doctors will work together with the patient to decide what is best for them. But certainly as far as existing therapy compared to back surgery, the laser is an extremely attractive option.
Yes, it certainly is. Now, why, for you personally, was this a specialty you wanted to get into?
That's great. I'm glad you asked me that. Pain management is my profession in life. It's what I do. For the first 8 to 10 years of my career in pain management, we primarily focused on salvage treatment, or offering hope to patients who had tried and failed other previous treatments, such as back surgery or various other types of medical treatment, and had not been as satisfied with their success. I felt this provided an opportunity for me to use my clinical skills as a diagnostician, as a former internal medicine specialist, to deal with an area of medicine that was complicated at best and many times associated with less than an optimal response from the patient's point of view. So I was attracted to pain management. But we initially were in the salvage business, where we would take patients that had failed what would be considered primary therapy and try to get a good outcome despite this. So when the laser came into being, it provided an opportunity to make progress that had only been hoped for before. It truly represents a paradigm shift and a new way of doing things, an effective way of dealing with a vexing problem, and provide hope where there had not been a lot of hope before. So it was very attractive to me for that reason as well.
Thank you for coming on the show.
Thank you for having me.
If you want to find out some more information, you can learn about laser disc decompression by going to foothillspain.com.